Hey, what's up? Welcome to the live stream. Thanks for joining. If you have any questions, go ahead and drop them in the chat. I'll go ahead and answer them. Hey, hope everyone had a really good weekend. Excellent. Hey, how's it going? So for those of you who don't know me, I'm Dr. Matthew Harb. I'm an orthopedic surgeon. I do mostly minimally invasive hip and knee replacements. I do a lot of surgeries at my surgery center, so same-day operations. And I work in Washington, D.C. and Maryland. And I've been doing educational videos on these channels on TikTok, a lot on YouTube as well, and just trying to help educate the public and give people some more musculoskeletal knowledge. How was your day? My day was great. I got a nice little workout in. Just finished up with that, and so this weekend's been pretty good overall. How about yourself? How long did it take for me to get where I am now? So it's about 14 years of schooling total. You have to go to 4 years. Well, in the U.S., you have to go to 4 years of undergrad. Following that, you go to 5 years of a medical school. Then you have to match into an orthopedic residency. Orthopedic residency is another 5 years, and then once you graduate from that, you do 1 year of a fellowship training, and that's then you can become a hip and knee surgeon. Alright. Just had my knee replaced. What's the best exercise to build flexion? So there's a couple different exercises that you can do. And the best one is really just passive flexion and extension. The therapists are going to teach you a lot of exercises, and so that's going to be really helpful. But one of them is putting your foot up on a stool. If you put your foot up on a stool, you can actually hang some weights over the top of your knee to get full extension. We call that a passive extension exercise. And then the other one is taking your other foot and putting it on top and trying to bend back. Had my right hip replaced and my groin is still killing me. Sorry to hear that. If you have a lot of groin pain, the groin is really the hip socket. One of the questions, you have a tendon right there. It's called the iliopsoas tendon. That can be irritated, especially if you had an anterior hip replacement. And so that would be my question on that end. Was your iliopsoas tendon irritated? What's my favorite color? Favorite color is blue. Hey, what's up? Yeah, if you drop any questions in the chat, I'll go ahead and answer them. Thanks for joining in. Dental assistant, appreciate all you do. Someone has to work in the teeth. Teeth are very similar to bones, and orthopedic surgeons actually got a lot of their materials and a lot of their implants ideas from early dentistry in the 1920s and 1930s. Hey, what's up? 7 months post-op. I'm glad you're doing so well. It's been hot here. Hopefully, I'm sure the weather may not be that much better in Texas. Aspiring to be an orthopedic technician, where should I start to learn more orthopedic things? They do have orthopedic technician training programs you can go to, and so those can be helpful. I would probably say maybe shadow an orthopedic surgeon or shadow some other techs. There's a bunch of different techs that work around orthopedics, meaning there's a cast tech, there's a radiology tech, there's orthopedic techs who work in the operating room, and so all of that can be helpful to learn orthopedic tech stuff. I dodged COVID for 3 years and finally caught it a few days ago. Sorry to hear that. Luckily I've never tested positive for COVID yet, so hopefully it remains that way. My daughter has tested positive for COVID, but not me. I'm in need of a hip replacement. Any ideas for pain prior to the surgery? There's a lot of things you can do prior to the operation. We can have good anti-inflammatories, things like meloxicam is a very good bone and joint medication, therapy to get the hip stronger, and then in rare circumstances, if we're very much trying to delay the operation, we would do what's called a hip cortisone injection into the hip, but we're not doing that often. Usually if it's bad arthritis, we're going straight to the replacement. Do I ever get bored of doing the same surgeries over and over again? I would say no, because every surgery is a little bit different. So every surgery has its own little nuances, and So every surgery, even though I'm doing a hip replacement, every hip replacement is not the same. Some people have dysplastic hips or hips that never formed right as a child. Are partial knee replacements more successful than complete knee replacements? I wouldn't say that. I would say the longevity of a knee replacement is actually a little bit longer with a total knee replacement. That's because if you have a partial, the most common mode of failure of a partial knee replacement is actually progression of arthritis. So that's one of the, and the other one would be loosening, but the actual overall longevity, about 30% of, or at 30 years, about 60% of implants are still intact for a total knee. It's slightly lower than that. It's about 65 to 70% of partial knee replacements are still intact at 20 years. So sometimes they do get converted if the arthritis progresses. Why is it always Ansef? Ansef's a really good gram-positive medication. Ansef covers the skin flora, meaning the bacteria that are on your skin. So I actually use Ansef and vancomycin to cover gram-negative, which is and gram-positive. Why does my knee randomly give out at age 12 and it hurts a bit? I just went over to summer camp. Look, you're still growing. There's aches and pains when you're young. It matters a lot if you're like that when your growth plates have fused. But if that will likely go away. There is a diagnosis called Osgood-Schlatter's where you get pain over the front of your kneecap. But you would probably have that on a constant basis if you're very young. Thank you for the comment, even though it looks like a bear. Why do people get tibial lengthening surgery? You may have seen a lot of advertisements for these leg lengthening procedures. They're very expensive. They're not covered by insurance. They're usually out-of-pocket cash, and there's a lot of complications that can happen from them. And usually you're maybe only maximum gaining 5 or 6 inches from the leg lengthening procedures. The implants themselves are like $20,000. And so they're very expensive. Whenever you cut a bone to make it longer, you have to get it to heal. And to get it to heal can be a process. You use a magnet to actually lengthen the bone over time, but it's a really expensive operation and a lot can go wrong. And you have scars. You're basically trading maybe a little bit of height or complications for some scars. Why would the hand surgeons use this old carpal tunnel procedures when I had a laparoscopic? Not every hand surgeon, especially older generation hand surgeons, may not be trained on the laparoscopic or basically arthroscopic procedure. So not everyone can do it. An open procedure, you can see everything. Recovery time for a torn labrum after a scope for a hip surgery. So it depends what they're doing the hip labrum surgery for. If they're doing it for femoral acetabular impingement, where they're cleaning up the bone, if they're having to repair the labrum versus just clean it up, all that can affect recovery, but it may take to get back to 100% and get back to sport. Sport after hip scope, usually maybe 9 months to a year, but a lot of the recovery is within the first kind of 3 months or so. Having nerve pain in my foot from sciatica, I did an epidural Friday, but no relief. Any suggestions? Very sorry to hear that. Sometimes the epidurals have a late kick-in. If they targeted that epidural area via MRI, that can be pretty helpful. So I would, maybe give it a little bit longer, and if it doesn't work, there are other options. Meaning, if there's a disc or something like that pinched, you could go in there and take it out. What's your preferred OR table? So I do a lot of my anterior hip replacements on the HANA table. So for hip replacements, it's the HANA table. And then it doesn't really matter brand, but it's just a regular operating room table for knee replacements. So you don't need anything special for the knee replacement tables, but the anterior hip replacement, yes. Is it practical for someone in your career stage to go into a fellowship in a different field of OS, I'm guessing operating surgery or orthopedics? For me, once you pick a field, yes, you could go back and do a fellowship, but you're competing against people just out of school who maybe are a little bit more competitive. So someone has to take you on as a risk of training you. There are people who have gone for dual fellowships, meaning like sports and joints. It's completely switching out of orthopedics. That probably wouldn't happen. Now, some people I know have switched, like they went into a general surgery path. They completely hated general surgery, and they went on to do an anesthesiology path. So I would say that's probably more common. I enjoy watching your shorts. Thank you for creating them. I'm celebrating my 1 year anniversary of sounds like an ACL reconstruction. Um, is that the most common surgery in orthopedics or something else? I would say probably the most common surgery, and I don't know this based on the literature, but I would say it's probably like a knee scope because so many people get knee scopes and they're just done so often. So it's probably some type of scope procedure. Um, and so, other very common ones: rotator cuff repair, ACL repair, hip and knee replacements. I've had a total knee replacement 3 months ago. I'm still very stiff with lack of range of motion. Isn't MUA the only answer? Usually around the 3 month mark, if you're not having um, a lot of recovery and gaining motion. I usually like my patients to be at least, getting past 90 degrees of flexion. If you're not there by 3 months, then you're going for manipulation if you're my patient. Can you explain osteonecrosis? Yes, I definitely can. Osteonecrosis is where your bone actually dies. It's also referred to as avascular necrosis. There's many reasons that necrosis can happen and bone death can happen, but the ultimate real cause is that the bone loses blood supply somehow. That could be through trauma, that could be through autoimmune diseases, it could be through medications. And so usually if you have necrosis, the bone may collapse. If you have collapse, the treatment is a replacement. How long do you do PT after hip replacement and how many times a week? I'll have my patients usually for the first couple weeks go 2 to 3 times a week for maybe 1 or 2 weeks. I have home therapy come to their house for 2 weeks. In total, they're probably doing about 6 to 8 weeks of therapy. Not everyone's the same. I've had some people do less. I've had some people do more. Thanks for the shares. Thanks for all the double taps, likes. I really appreciate all the support for the channel. You guys have been excellent as far as supporting the channels. What are your thoughts on stem cell replacements? There's not a lot of literature to support them quite yet. We want them to do a better job, but unfortunately right now they're really expensive and there's not good literature to support them. I'm not really doing them very much in my patients. So PRP and stem cell injections are not that common, at least in my office. Do I wear contacts or glasses? I do not wear contacts or glasses at this time. Hip replacement 3 weeks ago. No hip pain, but pain in the thigh and knee. How long? You're not that far out. Thanks for the roses. You're not that far out, so you're still going to recover. You can get stronger even 6 months to a year after a hip or knee replacement. Thank you for the follow. Thank you for the rose. I appreciate it. If you have questions, just drop them in the chat, either on YouTube or on TikTok, and I'll get to them. What's your preferred hip replacement system? What are your thoughts on the SuperPath? I use a lot of couple different systems for hip replacement. I'll use DonJoy. I'll use a little bit of DJO. I'll use a little bit. It depends on the case specifically. I may use Stryker as well. SuperPath is from the back. I do a direct anterior approach. You can't. The SuperPath, they say that you're not cutting muscles and it's more minimally invasive, but you can't see as well for what you're doing. Anterior hip replacements have been great. I get patients up, they're walking 30, 45 minutes after the operation. They're going home the same day. Do I do ACL surgery? I actually refer ACLs to my partner. I have a sports medicine partner, so I take care of all the joint replacements. They take care of all the hip and knee replacements. Will knees get better if one loses weight? That's a great question. For every pound you lose, it takes about 4 pounds off the joint. So that can be really helpful as far as reducing stress. We want people to be around a BMI of 40 prior to having a knee replacement, so losing weight can be helpful. 3 weeks status post total knee replacement. Is the stiffness going to get worse? Flexion's 93. I would say that's not too bad. 0 to 90 before 4 weeks is a good mark. The stiffness should continue to get better from there. You may have small setbacks. Recovery from a hip and knee replacement is up and down, but you'll get there. You'll be at a point up here where you're very much recovered. Thank you for all the shares, the double taps, likes. I appreciate it. You guys are supporting the stream, which is excellent. Name all the bones. Yeah, I think Google could help you out with that one. I saw ortho and thought teeth. You should see ortho and you should think muscles and bones. 16-month-old has mild hip dysplasia, the best treatment plan. So for hip dysplasia, the way we treat that in an infant or very, very young, we want to make sure the hip is contained within the socket. Now, depending on the level of the hip dysplasia, you may go, probably we're in a hip spica cast or a Pavlik harness. The Pavlik harness is kind of the first line treatment to make sure that the hip is contained in the socket. If the hip is contained in the socket when you're a child, then it should develop properly. You may have some uncoverage over time, but if it's reduced and in place, then hopefully the hip will develop normally. Now, regardless, there's still a risk for arthritis and maybe needing a replacement in 40s to 60 years old, which is the most common age. But just the goal is make sure the hip is in the socket. And I'm sure you're following with orthopedic docs. They may have done a couple ultrasounds to make sure, and so things to look out for is when your child's walking and making sure developmental milestones are hit, but those are all the important things. How do you change colors? Are you talking about casts? So we have different fiberglass cast colors to do. Make your cast whatever color we want. Hardest part of residency, I would say the hours. Residency is pretty unforgiving. You work, at least in my residency program, I worked more than 80 hours a week. Time off was minimal, and so it was tough. That part of residency was tough. It's not rewarding. You don't get paid very much, and so residency is just like this trial by fire that everyone goes through. There's no good way to do it. You want to pack in as much training as you can, and it's hard when you're working 80-hour work weeks and all your friends who went into tech or engineering are working like 30-hour work weeks or 40-hour work weeks. That part's tough. Seeing all your friends buy houses and things like that, but so that's the grueling part of residency. But then you come out on the other side and it's pretty good. Got a blood clot in the lungs during hip replacement. Why does this happen? Because whenever you have a hip replacement, there's an inflammatory reaction that sets off a clotting cascade, and the longer you're bedbound or not moving, if you have what we call stasis, meaning you're in bed a long time, then it can lead to blood clots. So you could be more prone to it. You could be not moving a lot, and you just had a surgery. Makes you perfect risk for blood clots. So I put all my patients on aspirin. It's 81 milligrams twice a day to prevent any blood clots. From your personal experience, what pointers could you give a pre-med student that's applying for medical school placement? So if you're applying for medical school and you're in pre-med, the things I would do are volunteer at a hospital. Reach out to your local university, see if you can get in with one of the departments. The research departments always need help. Volunteer your hours in a research department. Try and meet mentors and people who work with the school, meaning try and shadow, maybe shadow certain people to try and get more research. So volunteer at the hospital, research, and try and find some mentors. I broke my humerus fracture 2 years ago, and my hand is only closing like a C. So, it sounds like you have some nerve issues. Hard to say which one. Hand is very specific. You really need a good physical exam to know what's going on in the hand. If you can't close it all the way, it's either due to one thing, stiffness, which would be unlikely from a humerus fracture. But if you're having nerve issues, that would affect your muscles, which could also affect your function. Ortho bro. Hey, how's it going? Pain in my shoulder blade that radiates to my arm. Help. You could do some periscapular exercises. I would maybe see your ortho. They can get you a physical therapy script, some periscapular strengthening. What do you think of the podiatric field? So there's a lot of overlap. Podiatrists do foot, and it depends on states. The rules are different, and depending on their training, meaning some just do the foot. Some can go up to the ankle if they're licensed or they had a certain number of cases in their training. And so that's a lot of overlap with the orthopedic foot and ankle surgeons who can take care of everything, foot all the way up, tibia, whole body basically. And so there's a lot of overlap with that. Now, The same thing is true from hand surgery, meaning there's some plastic surgeons who are doing hand surgery. There's some general surgeons who are doing hand surgery. At the end of the day, we just need to provide good care for our patients, and I think there's podiatrists who can do that. There's orthopedic surgeons that can do that, and so that's just part of how it is. There's overlap between fields and specialties. Resolution for slipping ribs, hard to say. That's not really a diagnosis that is very common. You could dislocate like a first rib or something like that, but that's not really a diagnosis. Slipping ribs is not a clinical diagnosis. Charcot foot surgery, should I be concerned? If your foot's very painful and it keeps collapsing or you're prone to ulcers, then Charcot foot surgery can be helpful. Charcot foot is basically a neuropathic foot, meaning you can't feel your foot, so it goes in crazy directions and it gets all deformed. Running with arthritis. Yes, you can run with arthritis. For my patients who have really severe arthritis and they ask me the question, they say, "Hey doc, what do you think I should do? Am I okay to run? Or do activities will it make the arthritis progress quicker?" There's nothing specifically that goes to show that the arthritis will progress quicker. It's good to keep the joints strong and keep the joints moving. Why do I get sciatica that's very painful? You may have a bulging disc in your back, or the nerve may be getting pinched at some point. Is surgery the only treatment for a torn meniscus of my knee? No, it is not the only treatment. You can do things like physical therapy, bracing, anti-inflammatories, ice. You can go in there. Sometimes we'll do an injection, and then the last thing would be a scope to clean it up. It also depends on the type of meniscal tear. My mom has an L1 compression fracture, fell 5 months ago, still can't stand for long. Advice, please? Usually compression fractures don't need any type of surgical treatment. You may need to boost your bone density. The most common causes of osteoporotic or fragility fractures are distal radius, the back, and the wrist. So it's not uncommon. If that happens, get bone density checked. Make sure you're doing vitamin D, calcium. Probably you could even see an endocrinologist for check your vitamin D levels and make sure you're not osteoporotic. I have bone on my knee. What's a typical recovery for a knee replacement? About 80-90% recovery within 3 months. People even get stronger 6 months to a year after the operation. Difference between minimally invasive knee surgery versus regular. It depends. There's a lot of different things. It could mean the size of the incision. It could mean how much bone is taken. It could mean how much muscles or ligaments are cut. So those are all things to think about. What's the most shocking thing you've ever experienced as an orthopedic surgeon? As an orthopedic surgeon, you see a lot of stuff, so things don't really become shocking anymore, unfortunately. But there's some bad stuff that has come in, whether it's a little kid or an old grandma who got mugged, or someone who got thrown off a roof, or someone who tried to kill themselves by jumping 6 stories. That just becomes routine. Here's one. This was probably one of the most shocking. It was a young 18-year-old, and he was recording. This was probably like 6 years ago. His buddies were recording him. And he basically was a skateboarder, and he wanted to do like a cool skateboarding trick. And he decided to try and skateboard under an 18-wheeler as it was driving by. And so he went to skate under the 18-wheeler, and he got caught, and it actually dragged his knee on the ground. Luckily, he was still alive when he came in, but he was missing basically half his knee and needed a reconstruction procedure. So that's one of them. There's a lot of stories like that. You see those things when you work at a level 1 trauma center. You see like the worst of the worst, like people getting shot 22 times, or people getting stabbed over a like Chick-fil-A. So crazy stuff. Someone wanted to know the difference between Kenalog injection and cortisone shot. Kenalog is a type of cortisone. There are many different types of cortisone. Kenalog's just one of them, so they're the same thing. Yeah, definitely very, very painful. They found it sounds like giant cell tumor while they were doing your knee replacement. It's still not 100% years later. So there's two type of giant cell tumors. There's one called it's very similar to a PVNS. We usually call it PVNS in the knee. Or there's a giant cell tumor of a bone, which is in your bone. It sounds like they probably found a PVNS. And so if it comes back, you could get MRI surveillance, meaning you could get an MRI every so often to make sure the PVNS isn't coming back. As an orthopedic doctor, what are your thoughts on Graham, the science fiction human that was designed to survive car crashes? I have no idea who that is. I'll probably have to look it up. No idea who Graham is. I'll take a picture of that one. Or if you want to drop a link, in my Discord channel and let me know who Graham is, I would appreciate that. That way I remember. Do I do peds or kids with CP? I've treated them before in the past. That was when I was in New York. I'm not really doing kids anymore. I'm doing hip and knee replacements in adults. So it's called my specialty is adult reconstruction. So I do adult surgeries. Had 2 replacements 3 years ago. Lost 100 pounds. Will anything change for me? That's great. I mean, if you lost 100 pounds, that takes weight off your heart. It takes weight off your entire body, your muscles, your implants, your other joints. So those are great. Have you ever treated a flu vaccine shoulder injury? Yes, I have. Some people get shots in their shoulder and they just they flare up. And so I've seen some people come in with some issues after getting a shot in the shoulder. Yes. Not uncommon. Why is an L5-S1 ligament tear so hard to heal from and so painful? Usually if it's just a ligament tear in the back, they would have to diagnose that on MRI. Usually that's not too bad. The worst thing would be if your vertebrae have slipped, if your disc is bulging or pushing on your nerve. You got CRPS from a cortisone shot. That's a very rare circumstance. People develop CRPS most commonly when they undergo multiple surgeries. Chronic regional pain syndrome from a cortisone shot is, my question would be, where did you get the cortisone shot, and did they inject the cortisone shot? Maybe they didn't put it in the right place, meaning if the cortisone shot was injected directly into the nerve or caused damage to the nerve, that could cause chronic regional pain syndrome. But that's rare. I don't think I can recall seeing that before. But it can happen, right? Anything can happen if you're injecting something around a nerve. Starting ortho as an MP, favorite resource? Probably orthobullets.com. Do doctors have to go to the doctor? Yes, doctors do have to go to the doctor. Do we like to go to the doctor? No. Do we avoid going to the doctor and avoid getting our checkups and our own health? Yes, probably for too long. That's what they say. The joke is that doctors make the worst patients. As an orthopedic doctor, what are your? I've heard about your podcast show. Where can we watch that? So the podcast is up on Spotify. It's basically I'm taking these. I just repurpose a lot of these live streams and then I upload them so that people can listen to them. I think I have about 9 episodes. I have about 30 more live streams in the bank that I have to upload. But they basically me just answering more questions from people. Hey, what's up from Canada? Thanks for joining. Appreciate all the support for the stream. Double taps, likes. You guys really have helped my channel grow immensely over the last couple months, so that's very much appreciated. I'm creating a Discord channel where you talk about everything, medicine, finance, careers, advice. So I'm trying to build a community there. If you're going for a hip or knee replacement or know anyone, let's see. If you're going for a hip or knee replacement or know anyone who needs one, there's great guides on my website, matthewharbmd.com /links. Do I perform anterior approach for hip replacements? Yes, I do. I love the anterior approach. It's a minimally invasive surgery. I go between the muscles. I do probably 70% of my joint replacements outpatients, meaning patients are up and walking about 30 to 45 minutes after the operation. Pain is short-term recovery is very good with an anterior hip replacement. Basically built a state-of-the-art surgery center just for joint replacements, and so that's I'm in Washington, D.C. The surgery center is right across the line in Maryland, and no, Superpath is different. Superpath is from the back. Superpath is still a posterior approach. You those comments are okay. I think you don't. My ortho said the hip is deformed and it doesn't fit the socket. What would you advise for surgery? So you probably had a Perthes or dysplastic hip. So if it doesn't fit the socket and it's too painful, then you can, or you have really bad impingement. If there's arthritis, then the treatment is a replacement. Posterior hip replacement 3 months ago, still having issues. Most docs I work with do the anterior approach. Yeah, I think it's becoming more popular. I think there's a lot of benefits to it. And so anterior approach has been really good. What are your thoughts on elbow replacement? Asking for my mom. Elbow replacement is not done as much. If you're like a rheumatoid or you have a lot of health issues, then it can be helpful. Have you dealt much with occipital neuralgia? No, I haven't. Usually I would give that to a neurologist, but I know there are certain medications they can use to help with that. What GPA do you need to get into med school? So I had my science GPA was 4.0. My overall GPA I think was like 3.9. That will help you get in, but it's also about your extracurriculars, your volunteer work, how much, letters of recommendation, if you have any research. There's a lot of things that can make up for not having a super high GPA. And I know people who have gotten into medical school with a 3.2 GPA, so, or really low MCAT scores. Had a right hip replacement 6 weeks ago. A right knee hurts worse. You're not that far out. Other things can flare up after you undergo a big operation. It's not uncommon. Is a total hip a good idea for a leg length discrepancy? A total hip is not usually done specifically for a leg length discrepancy, but it can correct it at the same time, which can be helpful. Thank you, AMG. I appreciate it. Awesome. Yeah, I'll check out that link to Graham. I'm very interested. Anytime I hear like new things that I don't know about from people on the stream, I always love to look them up. Do most surgeons use a Mako robot? I would say no. Most surgeons do not. Have you ever successfully dealt with so with different types of nerve issues, there's many types of things you can do. So if there's a really bad nerve issue like you're talking about, then I would usually send that patient over to a pain specialist. They can do targeted injections, they can freeze the nerves, they can burn the nerves. Those can all be helpful. How do you feel about the JV regime? I don't know who this is, Free Thinker United. A regime is a regime. You can always learn from a regime, right? I had an ACL surgery, then I broke my tibia on top of my shin. Why didn't my ACL tear? So, two things can happen when you have a really bad injury. You can either tear your ACL, tear the ligaments, or your knee can dislocate, which tears the ligaments, or you can have a fracture. Okay. JB, I didn't know that's what JB stands for. There's a lot of people I know named JB, so, I'm not going to get into politics on this stream. You guys are free to discuss it amongst yourself, but that's something I'm going to stay far away from. What brand of knee replacement for a nickel allergy? There is a Smith & Nephew Oxinium knee that I'll sometimes use for knee replacement. What's your favorite trauma center? MedStar DC or Shock Trauma? I work at Sibley Hospital, so I'm at a level 2 trauma center. So, um, you know, do I get to pick a level 2 trauma center? I like Sibley. GW is fine as well. Arthroscopy 3 weeks ago. So stiff and swelling. Is it normal? You're recovering from. You're still recovering very early, so not uncommon. What am I driving? I don't drive any super fancy cars. I drive a Jeep Grand Cherokee. I really like it. I actually got that not too long ago. For me, I just spent a bunch of money on a new house. So we're building a new house. So that's where most of my investment has gone. Um, Hubby had a double hip replacement and now has fluid in the joint. Does that mean it's an infection? Not always. It depends what type of hip they had. If they had a metal on metal hip, that would be something I would worry about, metallosis or pseudotumor. Um, and so that's one of the things there. But I really appreciate you guys supporting the stream. I'm going to do more of these throughout the week. I hope you guys have a great upcoming rest of the week. If I didn't get to your questions or you had more questions, just go to my link in the bio, matthewharbmd.com/links. My Discord's channel is there. I answer Discord questions when I'm offline. So if I didn't get to your questions, drop them in there. If not, I'll see you guys on the next stream. Thanks for joining.